How do ultrasound and MRI scans diagnose testicular cancer? Have you ever wondered how doctors diagnose testicular cancer? Let's explore the roles of ultrasound and magnetic resonance imaging in this important process. Ultrasound is the first imaging tool doctors use for diagnosing testicular cancer. It is highly sensitive and specific, making it excellent for detecting testicular masses. This technique employs high-frequency sound waves to create images of the testicles. By doing so, it helps doctors differentiate between masses that are inside the testicle and those that are outside. Ultrasound can also distinguish between solid masses and cystic lesions. Solid masses may indicate cancer, while cystic lesions are usually benign. When looking at testicular cancers, they typically appear as well-defined, darker areas on the ultrasound images compared to normal testicular tissue. For example, seminomas often show up as uniform dark masses, while non-seminomatous germ cell tumors can appear more varied, sometimes with calcifications or fluid-filled areas. Additionally, ultrasound is beneficial for evaluating the opposite testis. This is important because it can help detect rare cases of bilateral tumors. It can also identify small or hidden lesions in patients who may have metastatic disease. Now, what happens if the ultrasound results are unclear? This is where magnetic resonance imaging comes into play. Magnetic resonance imaging uses magnetic fields and radio waves to produce detailed images of testicular tissue. When looking at malignant testicular tumors on magnetic resonance imaging, they usually show lower signal intensity compared to the high signal of normal tissue. Magnetic resonance imaging is particularly useful for characterizing lesions that are uncertain on ultrasound. It can confirm the diagnosis of cystic lesions, fatty masses, or benign solid tumors. Furthermore, magnetic resonance imaging can assess how far the tumor has spread locally, which is crucial when planning surgery, especially if doctors are considering testis-sparing surgery. In summary, ultrasound serves as the primary imaging method for diagnosing testicular cancer due to its accessibility and accuracy. Magnetic resonance imaging acts as a complementary tool when ultrasound findings are not clear or when more detailed anatomical information is needed. Both imaging techniques are vital for the early detection and diagnosis of testicular cancer. If you have concerns or questions about testicular cancer, it is always best to consult with healthcare professionals for personalized advice and management.